The following program is a UNC Charlotte production.
Welcome inside UNC Charlotte. In this edition, we take a look at the ways the university is staking its claim to the issue of nutrition here on campus, in our research, and throughout Greater Charlotte. From there, a visit with a UNC Charlotte historian who's just revealed a discovery in the Holy Land that may be the most significant evidence to date from the earliest days of Christianity. The university continues to grapple with reductions in state funding and the need to raise tuition and fees. We'll hear the latest from Chancellor Phil Dubois. We examine UNC Charlotte's strong partnership with the Levine Museum of the New South here in Charlotte. That and more coming up inside UNC Charlotte. You and I are probably quite familiar with a tomato, but residents in some of our neighborhoods here in Charlotte don't have access to tomatoes or other fresh produce. Food and nutrition issues continue to be central in our national and local dialogue. You may recall recently federal policymakers declared that pizza sauce can be considered a vegetable by the National School Lunch Program. Next, inside UNC Charlotte's Lisa Patterson takes a look at some of the key issues with our experts in nutrition and health policy.
Over the past 30 years, American lifestyles have changed dramatically. One thing that hasn't changed? We are what we eat, and what we eat directly impacts every aspect of our lives.
We know that a strong foundation in nutrition, healthy folks are well-fed folks, and that's not just in terms of total calories.
Meet nutrition scientist and dean of the College of Health and Human Services, Nancy Fey-Yensan.
What you see in the United States in terms of food insecurity doesn't really manifest itself the same way it does in third world countries that are facing famine and other disasters. But what you see are undernourished folks that may look healthy on the outside, but their nutrient intake is so poor that they really do need a safety net. When your nutrient intake is inadequate, you can't learn, you can't engage in work, you can't seek work. So all of those things become really inextricably tied together. There are all kinds of costs associated with poor nutrition that we don't always think about, especially in terms of just the economic well-being of a community and the social stability of a community.
Our food choices are shaped by a number of factors, including abundance of unhealthy food, lack of nutrition knowledge, culture, high cost of healthy food, low cost of unhealthy food, not knowing how to cook healthy foods, taste preferences, and lack of easy access to healthy foods. Assistant Professor of Public Health Sciences Beth Racine was approached by the Mecklenburg County Health Department to study food access in the county. Racine's study revealed that more than 70 neighborhoods in Mecklenburg County qualified as food deserts, or low-income areas that lack access to healthy foods.
So over 72,000 people live in food deserts, which is about 9% of the population of Mecklenburg County.
Racine says the people living in food deserts have food stores, but the majority are stocked with calorie-dense, processed, and convenience foods, not the fresh meats and produce you would find in a full-service store. Robin Emmons, who is a UNC Charlotte alumna and founder of the nonprofit So Much Good, has experienced life in a food desert firsthand.
Well, growing up in a food desert, I really didn't know that it was a food desert. We didn't have language like that then. It just was that you frequented the neighborhood bodega or a corner store. You would go into a convenience store where there was some white foam bread and a pack of hot dogs. Luckily for me, I grew up in a family where my parents understood the importance of having something living and green on your plate and promoting health. So I got that lesson very early, and I was fortunate enough that my parents drove 30 miles outside of our neighborhood to go to the supermarkets on the outskirts of our communities.
Individuals in food deserts are at greater risk of becoming overweight or obese, which is a precursor to diabetes, stroke, heart disease, and hypertension. But overall, obesity has increased threefold in the United States since 1980. Bill Brandon specializes in health politics and policy. Brandon sees a role for federal and state government policy in the battle against obesity and lifestyle diseases. diseases that cost the state of North Carolina an estimated $57 billion annually.
Two different issues. One is we do want food as inexpensive as possible. We don't want to subsidize the consumption of materials that are bad for you. I think an important distinction needs to be made between offering people opportunities and suggesting they take those opportunities to forcing people to alter their behavior.
Experts agree that a holistic approach is needed to change health behaviors.
Researchers have kind of come to the conclusion that it's easier to change, for people to change their behavior if it's not only one person that's changing, if it's a lot of things around them that are changing. So in the nutrition research world, we're focusing more on the environment around people as opposed to just trying to change individuals' behavior.
A movement to address food issues is afoot in North Carolina. Nonprofit organizations such as So Much Good are taking on food access and education.
So the primary way that So Much Good is addressing that is by really encouraging self-reliance in these populations by teaching them to grow in whatever spaces they have. Secondly, we have a 5-acre site in Huntersville. We grow intensively on that site, bring that food into the community, sell at farm stands at cost, all local, all organic, working with the community residents to build relationships, to provide them access, but also to educate them.
Programs offered through the North Carolina Cooperative Extension provide customizable, evidence-based nutrition education to individuals and groups in the community.
My focus areas are specifically in local foods, food safety, and farmers market outreach. And we have a number of programs and curriculums that are evidence-based and research, founded in research, that we provide to consumers. Something that we just started at Extension is our Mecklenburg Friends of Agriculture program. Really, the intent of this group is to get locavores and individuals who have an interest in growing the local food economy into one room, so that we can then begin to network and learn what others are doing in the movement. And what we see with that group is that many of the individuals in that group have a real interest in bridging the gap of access between growers and individuals who are in underserved communities.
Through outreach, research and scholarship, and programs that train the next generation of healthcare and public policy professionals, UNC Charlotte is an invaluable resource and community partner in the Charlotte region.
I think that this college has a great opportunity to share its intellectual capital with community-based agencies who are in need of that. You know, these are grassroots agencies who share our priorities. I am so proud to be the dean of a college that I think has really high social and community relevance in Charlotte.
Healthy people are happy people. And what we're talking about at the end of the day is not a prescription of a set of values. You know, what you see as the grand end of life, that's left up to people. But the means for advancing those ends, being a healthy lifestyle, is not an ultimate end, but it is a step towards the way. And it's been shown over and over again, whatever you believe the ultimate purpose of life is, it's going to be enhanced. You're going to be able to get to it more easily if you're healthy than if you're sick.